Hi, and welcome to my channel, All Things BBL, where I go over everything related to the BBL surgery. In today's video, I'm going to be going over the differences of hiring a private nurse or staying at a recovery home after your BBL surgery. And in this video, I'll also give you a short body reveal of what I'm wearing and why I look like this for this video. So when it comes to the BBL surgery, you can't do it alone. I mean, every surgery center, every doctor requires on the day of surgery that you have someone to come pick you up and stay with you for 24 hours. So you definitely can't do it alone. You can rely on family and friends or a boyfriend to come with you, but I've seen stories in my Facebook groups, I belong to my doctor's Facebook surgery group, where family or friends or even a boyfriend or a husband at the last minute have to cancel, and then you have no one to go to surgery with. So my suggestion and what I did is I hired a private nurse, so I knew I was gonna be getting service. I didn't have to worry about anyone canceling on me. So my experience was with the private nursing company, but I'll also go over recovery homes. That's another option if you don't want to do the private nurse route. And recovery homes are a whole different story. I never stayed at a recovery home, but I did watch a lot of videos on recovery homes on YouTube. So I'll be going over those differences. So I used a private nurse. I used the company StayRN. I'll put the link in the description below. And I got the 3-day exclusive package. I'll try and throw up a picture here to show you all what was included in my 3-day exclusive, or I think it's called the 3-day deluxe package. And the price was, at the time that I got my surgery, which was May 25th, 2021, the price for the 3-day deluxe package was $1,750. And when you first book it, you have to put up a deposit. I believe it was like a $250 deposit. And then you pay the remainder 1 week before your surgery. So I decided to go that route. And again, I said I'll try and throw up a picture here to show you what's included. But the private nursing company, StayRN, I have nothing but high regards for them. They were amazing. Again, I went to the surgery to Miami alone. I just brought my dog with me, actually. So having this private nursing service was a lifesaver. And, on the first day when I had my surgery, they were there to pick me up. They stayed with me for the first 24 hours. So I had one nurse who picked me up and stayed with me till the night. And then I had a nighttime nurse who stayed with me throughout the night. And while they're there, they'll cook for you, but you do have to buy your own meals, but they will cook for you. They monitor your vitals. So like every hour or every 2 hours, they're taking my blood pressure and my pulse and just making sure everything is okay with me. They monitor my medications. So for that first day, when I was out of it, I didn't have to worry about which medication to take. They wrote everything down. They gave me my medications. They were definitely very organized. I don't know what I would have done without them. So that was definitely a plus with the nursing service. And another great thing is, since I got the 3-day package, they were also there to pick me up. They were also there to come pick me up 1 day post-op for my Postop Massage. So they were there. They have like a special van that already has an air mattress in the back, and you're able to lay down comfortably. So they took me to my first post-op. They waited. And then they brought me back to the hotel, and then they stayed and helped me shower, and then they left. Because on the second day, I didn't have them for 24 hours. I maybe had them for 6 hours. So that was another plus. And the StayRN also includes, in this deluxe package, they include 2 massages. So a masseuse will come to your room and give you massages, in addition to the massages that you'll probably get at your doctor's office. So that was another positive thing. And then another unique thing they provide is IV solutions. I'm not sure exactly what it's called. You'll have to check the website. But on the day of surgery, later in the evening, another nurse comes and they give you like an IV solution to help replenish your fluids. And they also give you something called a butt shot, but they give it to you in your arm. And it's like filled with B12 and other vitamins. And it's supposed to help keep the fat and just maintain your body fluids or something. I'm not sure exactly what the scientific reason is for the butt shot, but it was great. I know after I got my fluids put in and after I got the shot that evening, which was the first day post-op, I felt amazing. So that was a great service that they provided. Again, that was done on the day of surgery, was when they did this IV solution in the evening. So that was great. And also, while the nurses are there with you during recovery, they're making sure you get up to walk every hour or whatever your doctor recommends. Again, I said they cook for you. So they're definitely, busy doing things for you, whatever you need, making the bed. It's just such a huge help to have that when you're feeling so out of it, just to have someone who you don't know waiting on you hand and foot, and just being so accommodating and so nice and so friendly. And also with StayRN, they also provided me with some supplies, so I didn't actually have to buy a lot of supplies. They did give me like a little nice pink duffel bag filled with supplies. They provided a BBL chair, which I didn't use, so I returned that. In exchange for the return, I got an extra faja. And StayRN also gives you a faja with the 3-day deluxe package. So I ended up having 2 fajas. So that was nice. And the only con I will say with StayRN was they actually create an itinerary for you. So if you get the 3-day package, they let you know when your masseuse is coming, when your nurse is coming. So if those times conflict with, say, your post-op appointments or your post-op massages at your doctor's office, it's going to be hard to change. You're going to have to try and change your doctor's appointments, because StayRN, they're so busy that once they send you the itinerary and it's created, you really can't change anything. So I did have to end up missing one of my massages with StayRN because it conflicted with my doctor's massage, and my doctor was so busy they couldn't change theirs. So I just had to miss out on one of the massages from StayRN. So I would say that's the only downside, is you have to really pay attention to that itinerary. Again, I didn't pay attention to it because there was so much going on post-op that I completely forgot there was an itinerary to follow. But make sure you look at your itinerary and try and make sure your doctor's office can work around it. But a lot of times your doctor's office can't work around it. So that's just one thing to think about. But all in all, I would definitely say if you don't have anyone to go with a private nursing company. I use StayRN and I highly recommend them. And one more thing to add about StayRN is when they come to pick you up on your surgery day, they also have a wheelchair. So once you get back to your Airbnb or to your hotel, after you get out of the car, they put you in a wheelchair and wheel you right up so you don't have to worry about walking again. That was such a tremendous help, and it just made the whole, getting out of surgery part that much more easier, the fact that they have a wheelchair for you. So your other option, if you don't want to go the private nurse route, you can stay at a recovery home. Now I know these are very popular in Miami, and when you go overseas to the Dominican Republic and to Colombia, recovery homes are just very popular. So now a recovery home is like someone's private home where they have multiple people recovering from surgery, and you could either have a shared room, either with 2 people or 3 people, or you can have a private room. So it's more like a dorm setting. You're recovering with other people. So that could be a plus or it could be a negative. I know there are some recovery homes that let people bring guests, which makes the recovery home even busier. So that could be either you like having a lot of people around, or maybe you want to recover more in a private setting. So that might not be for you. Another plus with the recovery homes are all your meals are provided, and pretty much all your supplies are provided. And sometimes the recovery homes, they also offer in-house massages, so you don't even have to leave the recovery home. And there's always transportation available. So those are a lot of pluses that all those things are provided. I would say the only downside with it is it can get crowded. I mean, if you're not one to like to have a roommate, you might not like that type of setting. Or if it's a recovery home where they allow other people to bring their guests, again, you might not like the setting of a lot of busyness going on. So since I didn't stay at a recovery house, I don't know any of the names of the ones that are in Miami, but I would say do your research on YouTube. Just type in Miami recovery homes and you'll see a lot of YouTube vloggers giving great detailed reviews on which recovery homes to use and which to stay far away from. And you could also search for them on Instagram. Just do a search for, hashtag recovery homes Miami. And what I also heard is sometimes the recovery homes are not actually in Miami. They'll actually be on the outskirts of Miami. So I've heard of some girls, having to drive 40 minutes from the recovery home or being transported 40 minutes from the recovery home to their doctor's post-op appointment because the recovery home isn't actually in Miami. And I heard the recovery homes, some of them won't give you the address for security reasons until like the day before your surgery. So you can't even research the location until the day before your surgery, which is when it's pretty much too late to change. So you have to be very careful of that. Maybe try and find out where the locations are ahead of time by, again, doing searches on YouTube. Because that could get very annoying if you're staying 40 minutes away from your doctor's appointment and have to travel back and forth there. And also with the recovery homes, I know they have a minimum or maximum stay. Usually it's 5 days. So if you have to get to Miami, say a few days earlier, you'll have to book a hotel and then check out and then go to your recovery home like the day before surgery. Then you stay there 5 days. But if you want to stay in Miami longer, then you'll have to check out of the recovery home and go back into another hotel. So definitely find out what the minimum or maximum number of days you can stay there. I know some of them will give you transport back to the airport, or some of them offer other options, but just make sure you find out what the minimum and maximum amount of days you can stay there for. Because I can see where it could get a little annoying where you're checking in and out of hotels during a trip. Say if you stay in Miami for 7 days, you gotta check into a hotel on your arrival, then check out, then check into another hotel after your 5-day stay is up. And then, I don't know. I just don't like checking in and out of places, so that's not for me. But if you don't mind doing that, that's fine. But again, every recovery home is different. Some of them, might have a maximum stay of 10 days. So it just all depends. So basically it's a preference. If cost is a big option and you're trying to, keep your costs down, a recovery home is better than a private nurse. Or, if you don't like having a lot of people around and want to be in your own little space, then it might be worth it to pay the extra to have a private nurse. It's all a personal preference. But again, at least there are options out there if you don't have family members or husband or boyfriend to come take you. There are options out there. So here I am, still 5 weeks out from surgery. I'm in my stage 1 faja. I'm waiting for my stage 2 faja to come in. So I have to use extra compression on the outside. Inside my faja, I have my foams and I have a tank top on under my foams so I don't get imprints on my stomach. And then over my faja, I have this waist cincher like Velcro so I can adjust the tightness throughout the day. Sometimes it gets too tight and it actually makes me not hungry. So then I'll have to loosen it up, but it's still providing some extra compression. I do like the feel of it being tighter. Makes me, but it's still bulky. When I have a dress on, you can still see it. So basically this is just what I wear when I'm around the house. And then you can see the butt. The butt it's not compressed tightly, but it's just held up nicely. From the side. Again, this is very comfortable. It comes like mid-thigh, so I can wear a dress with it. And I just like the way it shapes and sculpts the butt. It like keeps it sitting up. So that's my 5-week update. Thank you so much for watching. Make sure you like the video and leave a comment below. Let me know what your preference is. Would you rather hire a private nurse or stay in a recovery home? Or let me know your experiences. What private nurse company did you use? Or do you have any good recovery homes to recommend? And make sure you subscribe.